Hi again, and welcome back to Integumentary Part 2, and we will start talking about cutaneous infections or skin infections. Okay, we just talked about inflammatory disorders. Okay, the first one is cellulitis, and cellulitis is an infection of the dermis and the subcutaneous tissue, and examples are wounds and ulcers. This is something most of us are familiar with. And erysipelas is also a bacterial skin infection involving the upper dermis with a sharply demarcated border. Let me get this. I picked the wrong one here. Okay. So this, we're talking about just more superficial upper dermis, a sharply demarcated border. We can see clearly a border versus cellulitis that it's just a little bit more blurred and deeper. Its well-defined margin can help differentiate it from other skin infections like cellulitis. So cellulitis refers to an acute, superficial, diffuse spreading skin infection. May refer to infection involving the deeper dermis and adjacent subcutaneous tissue. So there's not as much demarcation and it's deeper. And the erysipelas refers to more of a superficial infection involving upper dermis and superficial lymphatics with a more clearly delineated border. That's the difference between the two. And that is caused by bacterial infections. So both of these are bacterial infections, and you can see that the skin swells and the skin becomes tender. This erysipelas, another name for this, I'm not sure if you've ever heard St. Anthony's fire. That's another name, and again, it just affects uppermost layers of the skin, not as deep as cellulitis. The next one is impetigo, and it starts with a red, itchy sore. As it heals, a crusty yellow honey-colored scab starts forming over it. It's a mild infection that can occur anywhere on the body, but it most often affects exposed skin. Most commonly, we see this around the nose and the mouth. So this is highly contagious. It is a bacterial infection, so it is treated with bacterial, like an antibacterial ointment or an antibiotic ointment. Again, itchy, it can be painful. This is something that could clear up on its own, but because it's highly contagious and it can spread quickly, we do want to treat it with an antibiotic cream. Okay, now these are some viral skin infections. Number one being herpes. And herpes is categorized into two different types. Herpes simplex 1, primarily oral herpes on the lips and the mouth, and herpes simplex type 2, which is primarily genital herpes in the genitalia. Excuse me, I'm sorry, gosh. So herpes is transmitted either oral to oral or genital to genital or oral to genital. And it's spread through close contact. There is no cure, but there are antiviral medications that, if taken daily, can shorten these breakouts. Herpes simplex type 2 is considered an STD. And again, it could be asymptomatic, or somebody could have these painful blisters. The varicella zoster, another virus, talking about chickenpox and shingles. Number one, chickenpox is an infection caused by varicella zoster virus. It causes an itchy rash with small fluid-filled vessels. Generally, we see this in children, but now, the last couple of decades, there's been a vaccine for this, so we don't see it as much. Shingles is also caused by varicella zoster virus, important to know. After somebody recovers from the chickenpox, this virus stays inactive or lays dormant in their body. And this virus can reactivate later, and when it reactivates, it causes shingles. And things that could reactivate it is just like a decreased immune system, maybe any medications that can decrease in immunity. maybe stress is something else. Somebody has a high stressful situation. This virus will reactivate. Being out in the sun. Those are things that certainly can trigger shingles. Most people who develop shingles have only one episode during their lifetime, but not all. Some people have multiple times if they have a decreased immune system. So the shingles is the same virus as the chickenpox. And for the shingles, the outbreaks often follow the distribution of nerves in the skin. And the distribution pattern is called a dermatomal distribution or a dermatomal pattern. And this just kind of shows, this dermatomal distribution kind of shows the most common places that somebody gets shingles. You can see these nerve distribution patterns. And most commonly, shingles we see in the thoracic area right here, about 50% of them. You can see it follows that dermatome. That's one way of diagnosing it. Generally, they get it in only one dermatome, so that means they have it only on one side of the body. Again, most commonly the thoracic, but we certainly can see it up in the neck and the cervical area, and certainly we see it in the trigeminal nerve and the face, either in the forehead, the eye, or down here by the jaw. Lumbar area also has, so we can certainly see it there, but this is what it looks like, and it's in this dermatomal distribution. Hand, foot, mouth disease is a mild, contagious viral infection. Adults can get it, but it's more common in young children. And it typically is a viral infection that affects the skin that they get in daycare and they get in schools and playgrounds and things like that. Symptoms include sores in the mouth and rashes on the hand and foot, hence the name. Most commonly caused by the Coxsackie virus, and there's really no specific treatment except frequent hand washing and just avoiding close contact with somebody who has it. Just when the child has it, they should really stay home until their little rashes on their hand and feet and mouth go away. This is called molluscum contagiosum, and this is an infection caused by the pox virus. Very common, the molluscum contagium virus or the pox virus. These lesions over here, you can see these lesions, they're known as mollusca, and they're raised and they look kind of pearly. They have like this pearly color and they have a pit in the middle of it. They're itchy, they can be sore and red. The result of the infection is usually benign, mild skin lesions, and these can appear anywhere on the body, and this is usually self-limiting, just these kind of raised these little raised lesions. The next one are warts, and warts are small, hard, benign, meaning non-cancerous skin lesions, and all warts are caused by some strain of the human papilloma virus. So that's important to know. So for some type of a HPV. Whoops, sorry. You can see over here, this is an example that somebody has a wart up here on their hand. So it causes excessive keratin develop on top of the skin, and it just kind of keeps developing and developing, and it gives them this hard texture here. These genital or venereal warts, a common sexually transmitted infection, and it's passed on from skin to skin contact. And again, all warts are caused by the HPV, even the genital warts. So sexually transmitted, and it is a cause of cervical cancer. It occurs in the glands of the penis, the vulva, or the anus, wherever the touching of the spread is. The next here are fungal infections that we'll talk about, so skin fungal infections. And the first thing I want to talk about is this word tinea. It's helpful to know that tinea means any disease caused by a fungus. So anything like ringworm, which is caused by a fungus, jock itch, which is caused by a fungus, athlete's foot, which is caused by a fungus, is the medical term is tinea. So tinea capitis is a fungal infection capitis on the scalp. Tinea pedis is a fungal infection on the feet. And you know this is athlete's feet. And you can see the fungus infection, which tends to be these raised kind of vesicles and dry, flaky kind of skin that goes with it. Tinea corporis is fungus on the body. You can see this right here, this round, kind of crusty, circular type of a lesion, and that is another name for that is ringworm. Tinea inguum, which is a fungus on the nail beds. It could be the toes, it could be the fingernails. Onychomycosis is another name for that, meaning a fungus on the nails. So tinea is a fungal infection. And these fungal infections could happen anywhere on the body, and they are treated with antifungal medication. So they are certainly something that can be treated by either putting creams or lotions on these areas or even taking oral medication. The next fungus here is candidiasis, which is a fungal infection caused by a yeast called Candida, and we're all familiar with this right here because it's common. Some species of Candida can cause infection in people. The most common is Candida albicans. It normally lives on her skin and inside our body, in the mouth, in the throat, in the gut, in the vagina, actually in the lungs, and there's no problems because they're balanced. But when they become out of balance, we can get a infection or a fungal infection in the mouth, in the throat, vagina. Those are common areas that we see it. Or just in moist areas of the skin, like somebody who has maybe some obesity, and we can get a fungal infection in the moist areas underneath maybe a roll on the skin or underneath not underneath breast tissue. So those are common places. Almost every woman gets a vaginal yeast infection at least one time in their life. And it's generally an opportunistic infection or super infection, meaning that something has occurred. And we know that one of the most common reasons is an overuse of antibiotics. So when the antibiotics are taken prolonged, then it kills the bacteria that we're aiming to kill, but it also kills some of our normal bacteria, our biofilm, and it can cause an overgrowth of yeast. That could be something that can cause an overgrowth of yeast. So yeast is a fungus. The next one here are nigra meaning dark. This is acanthosis nigricans. So acanthosis just means overgrowth. So an overgrowth, just kind of like a skin condition that causes this dark kind of overgrowth of skin cells that occurs in creases and body folds, like this lady right here, her neck, or we see it on armpits, groins. It can occur in a dark skinned person. We see it just a little easier on a dark skinned person because it's a darker brown, or we can see it on a lighter skinned person, may just look like a darker color of skin. So armpits, groin, like this woman, neck, not an uncommon place to have it. This is usually caused by an insulin resistance. So somebody who's overweight, somebody who's obese, somebody who is pre-type 2 diabetic, somebody who's a type 2 diabetic would manifest this type of a skin disorder right here. There's really no treatment for it. It's just a characteristic of insulin resistance. Okay, the linea nigra is just that little dark line that develops on the stomach during pregnancy right here. And all colors of skin. It happens with all women due to an increase in hormones, but generally this will fade or even go away after childbirth and the hormones start to rebalance out. And then this right here, papulosa nigra, It's a hyperpigmented, so a dark papule, and they develop on the face and neck. And this is Morgan Freeman. And if you know who he is, he's an actor, you see that he does have this on his face. It does most commonly affect people of African descent and Asian descent. These are certainly benign and they can be removed by laser surgery because they can become unsightly. But if they're not removed, they really don't cause any problems if the person doesn't mind. These are some birthmarks. So this is called Nevius flammeus. And another name for it, you may have heard it be called a stork bite or a wine stain. And sometimes these resolve on their own and they disappear. Oftentimes they fade. But usually by the time the baby starts to become childhood age, these have faded quite a bit, so they're not noticeable. Cafe a la spot, the same thing. It's a birthmark. This one doesn't fade though. It's just a dark spot that somebody's born with. Again, completely harmless. Just more of a aesthetic type of a issue if it causes any issues for anybody. And another birthmark, this hemangioma. You can see this little baby has this bright red birthmark. General, again, these are harmless. They resolve on their own. And it's a benign tumor made up of blood vessels. You can see this little blood vessel has all these little roots coming out of it. There's many types of hemangiomas, and they can occur throughout the body, including skin, bone, muscle, bone, and internal organs. Again, these just kind of take care of themselves. They can resolve. They will resolve on their own. These little blood vessels just start breaking off, and then this will go away. This right here is called Bacterial. It's a disease that causes patches of the skin to lose their color, and the pigment making cells, which are melanocytes. So Bacterial occurs when melanocytes or pigment making cells, these are the cells that make our pigment, are attacked and destroyed by the body's autoimmune system, or immune system, which is an autoimmune disorder. When pigment making cells in the skin are destroyed, people develop these white spots. Again, very benign, but it can be traumatic. It can cause some psychological issues. This happens to be a famous model named Winnie Harlow. She's a fashion model and she became famous, and she does have what we call vitiglio. You can kind of see these white spots here where her melanocytes were attacked, so they just didn't color this part of her skin. This next one is dermatitis medicamentosa, or drug eruption. So it's a reaction generally to a drug. If somebody has a reaction, a skin reaction to a medication. Onset is an abrupt and widespread anti-symmetric erythematous eruption. So all over the whole body here. May resemble inflammatory skin conditions. True allergic drug reactions involve prior exposure to the offending drug and require minimal doses to elicit a reaction. So they're allergic to a drug even at minimal doses, and they have had it before, so generally the reaction occurs on the second dose, not the first dose. Classification of adverse cutaneous drug reactions. So just a couple things that could be helpful for you to know. Penicillin-based medication, so anything with penicillin, amoxicillin, augmentin, you'll learn. Penicillin-based medications and TMP-SMZ, which is Bactrim, are the most common causes of urticaria and mucopapillary allergic skin. So these are two antibiotics, penicillin and Bactrim, which are the most commonly allergic antibiotics. Helpful to know. Cephalosporins are associated with reactions in 5 to 50% of penicillin-sensitive patients. Patients who have a penicillin allergy, 5 to 15% of those, it depends on what you read based on this right here, about 5 to 15% of those people who have a penicillin allergy also have an allergy to cephalosporins. Red man syndrome, which you should know because you're all nurses, that happens when we give somebody vancomycin too quickly. That is not an allergic reaction. That does not mean they're allergic to vancomycin. It just means when they get this red urticaria, they get this erythema and sometimes urticaria. It just means that the vancomycin is being infused too quickly. They're not allergic to it, and what we suggest is the infusion gets slowed way down. ACE inhibitors, medications that end in pril, like enalapril, are associated with chronic coughs. That's one of the side effects, and angioedema, which is a form of an allergic reaction. So ACE inhibitors, it's not common, but it does happen. Sometimes patients will have an allergic reaction and they manifest with angioedema, not necessarily skin reactions. Beta blockers, metoprolol, atenolol, can precipitate asthma. We know that because they are beta blockers, and if they block the beta 2 cells on the lungs from responding to adrenaline, they will get bronchoconstriction. So beta blockers can precipitate an asthmatic response. Anticonvulsants and any medications with sulfa in it, sulfonamides like Bacterial is a sulfonamide, is a sulfa antibiotic, are the most common causes of toxic epidermal necrolysis, which we call TEN, and Stevens-Johnson syndrome. Okay, this is an antibiotic, is the most common antibiotic that can cause this truly deadly reaction, which I'm going to talk about in a minute. So that's important to know. Radio contrast like IV dye and opioids may stimulate mast cell histamine release, because we know that people are allergic to dyes and people are allergic to narcotics and opiates. And that is because these two medications can stimulate mast cell histamine releases and they have an allergic reaction. How do we manage? Withdraw the medication might be the only treatment necessary. Just stop the medication. Treatment is aimed at symptoms, so epinephrine IV or sub-Q may provide rapid relief from the urticaria and angioedema. Repeat the epinephrine as needed. Diphenhydramine, which is Benadryl, may follow. Diphenhydramine is an antihistamine and it will block H1, histamine 1. Famotidine, which for 3 days, which blocks H2. These are H2 antagonists that we typically take for GERD. It blocks the histamine, the second histamine, which is in the belly. So both of these histamine blockers are also warranted for any type of an allergic reaction. And of course, if they have any systemic symptoms, we're going to hydrate them with IV fluids to fill up their vessels if they have hypotension. This is just a picture of a little boy who has some angioedema. The eyes are so swollen. This is swelling in the face, lips, tongue, nose can become very serious. Urticaria, which are hives basically, and then erythema, you can see, which is the redness, kind of splotchy redness on her face and body. Erythema multiforme, or EM, is an acute, self-limited, and sometimes reoccurring skin condition that's considered to be a type 4 hypersensitivity. If you remember, that is the fourth type, which is a delayed hypersensitivity reaction associated with certain infections, medications, and other various triggers. May be present within a wide spectrum of severity. So this EM could be serious, and you can kind of see it. Generally something that we can see, especially when patients start having an allergic reaction to any type of a medication. You can see this big, wide, large circles with a lot of them have like that little bit of whiteness in between. So these big circles, and these can, like I said, be present within a spectrum of severity. Maybe there's just a few of them, or maybe they can be covering the body and become very severe. So this is something Anybody who gets this, whatever the trigger is, whatever the agent is, it needs to be discontinued, because this can progress, this erythromaltiform can progress into what we call Stevens-Johnson syndrome. Stevens-Johnson syndrome is a rare but serious skin reaction that's usually caused by taking certain medications. It needs to be treated immediately in the hospital. It's sometimes called toxic epidermal necrolysis, or TEN. It's like a burn. It's like the skin got burned. And what this looks like on the outside of the skin is occurring in the inside and the soft tissue inside the body as well. A reaction to medication that starts with flu-like symptoms, kind of some aches and pains and malaise, followed by a painful rash, generally erythromaltiform, that spreads and blisters. So it's like a burn, and then it starts to blister. Then the top layer of this affected skin dies, sheds, and hopefully begins to heal after several days. Or it can progress. A medical emergency that usually requires hospitalization. Treatment focuses on removing the cause, whatever the medication is, caring for the wounds, controlling the pain, minimizing complications. As the skin regrows, it can take weeks to months to recover. So this is somebody with less than 10% of their body affected. The Stevens-Johnson syndrome that has just this blistery burns on the skin. Look at this right here. And then as more of the body's affected, they have Stevens-Johnson syndrome, and this toxic epidermal necrolysis occurs as the skin starts necrotizing, and then it can become very serious into just TEN when greater than 30% of the body is affected. You don't need to memorize any of these numbers. Just know what Stevens-Johnson syndrome is. Know that it's serious, and it generally happens because of medication reactions. About as serious as we can get with that. Okay. And we'll be back for part